Glaucoma, the silent disease, has eluded clinicians and researchers alike for many years. Despite several advances in its diagnosis and management, a big blind spot remains. Currently, we measure IOP weeks or months apart. Are we missing essential data? Is the pressure we measure every few weeks to months giving us a complete picture of the disease? What if the IOP looked like this between visits? What if it looked like that? Big gaps in our knowledge remain. How important is fluctuation in pressure? What really happens in low-tension glaucoma? We see fluctuations and rhythmic patterns in all walks of life. We see them in nature, most importantly, they are numerous metabolic and physiologic repetitive patterns such as blood pressure, pulse, hormones. Are there patterns in eye pressure that we are missing? The wireless IOP transducer, the WIT, is a novel device that may allow us to collect such data. It measures 11.3 mm in diameter and 0.9 mm in thickness. It consists of an electronic pressure transducer and a circular antenna. The device is encapsulated in silicone. The data is transmitted wirelessly to an external reader. The major electronic component of the device is the ASIC, an application-specific integrated circuit which houses the sensor membranes. The intraocular pressure indents the membranes, resulting in a change in capacitance, which translates into an electrical signal transmitted to the external reader. To test the device, animal studies in New Zealand white rabbits were conducted. The WIT was inserted in the sulcus space after lens removal. To measure the IOP, the reader is placed within 5 centimeters of the eye. The animals were followed for as long as 3 years. The device was very well tolerated in the eye. No difference was seen between the study eyes and the sham eyes. Pathologic examination at 25 months did not reveal any fibrosis or inflammation around the transducer. To validate the WIT pressure readings, manometry experiments were conducted. A needle was inserted in the anterior chamber and connected to an external pressure transducer. These experiments show high concordance rates between the WIT and manometry. The animal studies results were published in IOVS in 2011. After Institutional Review Board approval, the device was ready for human implantation. The WIT was implanted in a human eye in June of 2011 at the Beirut Eye Specialist Hospital. Following careful planning, the procedure was uncomplicated and the WIT was inserted and unfolded in the ciliary sulcus after cataract extraction and IOL implantation. suture was needed to close the 4 mm incision. Here the pressure is being checked immediately after the operation. The patient has since been able to measure her pressure at home. The data was downloaded from the reader at each visit. This is an example of the type of data collected. A significant amount of long-term as well as short-term fluctuation was noted. A distinctive pattern was seen in overnight measurements. Here's an example of a continuous IOP measurement curve where the width was able to collect up to 10 IOP samples per second. The patient was followed for 20 months without signs of intraocular problems so far. Another intended use of the device is IOP measurement in keratoprosthesis patients where finger palpation is the only way to assess pressure. A lot of work remains to be done to ensure the device safety and accuracy in a larger number of subjects. The WIT is a promising technology. How will it help us defeat glaucoma? Will 24 hours IOP measurements matter? Will patients one day be able to have their IOP transmitted wirelessly to their doctors, thereby reducing the frequency of office visits? A new era in glaucoma management may be upon us. We may be able to finally decipher glaucoma's blind spot and move our patients from darkness to a future of brightness and peace of mind.